Am I that afraid? And I was. So all my years of being in the field of addiction and working inpatient, outpatient, nothing prepared me for being the family member, the caretaker, the caregiver of someone who was addicted. I know what it was like to be the child of an addict. I knew what it was like to be the therapist. But to be the family member is a whole different gig. And the range of emotions that happens while you're a caregiver is crazy making. That's as close as I can come to a diagnostic term, is crazy making. And it's perpetual, and it leaves a residue upon us. Peace is gone from the minute your loved one starts using. And it doesn't matter if this is a spouse, if this is a child, if this is a family member. So I use this term caregiver very loosely because it affects every person that loves. As soon as there's love, there's this connection. And when you're loving someone and they're hurting themselves, that connection gets disrupted. It doesn't necessarily get broken, it gets disrupted. Trying to love someone in an addiction when you want them to stop and they want you just to be okay with them. My niece had this saying that rocked my world. It changed everything for me. I took her to Panera Bread for my own version of an intervention, not because of any reason for her, but because I knew I couldn't yell that loud if I was in public, and I had to have some sort of container for myself. So we went to Panera Bread, and she thought this conversation was going to go very differently, and I was very calm, very loving, like, can I help you with your 12th treatment center? Can we work on this? And she said to me, I love you. And I'm sorry that you can't love me the way I am. And that broke me. It still breaks me. But it stuck with me. Because the condition we had for me to continue to be in a relationship with her, here's the condition. I want you to be normal. I need you to be okay. I need you to be clean. That's my definition of you being normal, and by the way, is I want you to be clean. And her question was always, why is it so important to you for me to be clean? She wasn't breaking the law. I mean, I couldn't sit down with her and say, there's this judge and you're going to go to prison if you, that's easy. She not broken the law. She's not doing anything wrong except not living the life I would like for her. And so oftentimes we have this opinion about families, either that they came from a broken family, or they came from a family that created some level of trauma, right? We have a trauma-informed approach, and that there's this basis that something happened to make you like this. What happened? So the primary goals of this presentation and of radical self-care is to, first of all, protect the mental health of caregivers of addicts. So in my own story, my mental health, wow. I don't even know where it went. It went fast. My anger, my rage, my sadness, my crying. I was up to 5-mile hikes. I mean, that was good. I just couldn't walk enough to shake off this sense of anger and fear. So protecting family members' mental health, because family members often feel isolated. They're often not consulted with. And in fear and anger, I like anger better because I just, that fearful thing is just so for somebody else. It's not for me. So anger just seems much more acceptable to carry as our suit of armors. But it's so destructive to our mind and our body and our spirit. Secondarily, we want to teach skills to promote recovery. I'm not talking about the recovery of the addict. We have tons of presentations on that. What about recovery for families? What does recovery look like if their family member never wants to get clean? It is that person's choice whether they want to be clean. Do the family members have a choice to be healthy, happy, and whole? And how do you make them healthy, happy, and whole? There isn't a 28-day program for them. They don't get the benefit of all the skills and the resources, nor have we taught them that they deserve that. And the last thing is to prevent maladaptive behaviors of caregivers. Because just for those two examples that you had, what if, when, how that person gets to come home and they do have the skills and they do have the internal resources, but nobody else in the family has healed and they're still having a lot of trauma reaction to the addiction. When it comes to building resiliencies in families, the literature gets very lean. Very lean. There are great studies that come from the community reinforcement approach, community reinforcement family treatment. In the 80s, we started to have a lot of books that came out onto the market, and we talked about codependency. So in 2019, codependency is getting a new review and looked at a little bit differently. But there are some things that were very, very right about the codependency model. So some of those included, there's low self-esteem that goes with codependency. People pleasing, poor boundaries, reactivity, caretaking, control, kind of that, what's the sketch of the raging codependent? Ooh, it has that term in it, raging, right? There's this raging space, which I felt the rage. I'm going to just say that. I got that. Is there a better model? Do we have a better model? Do we have a better model for families? Right. It's a trauma-informed. Living through addiction is trauma. What you experience on the streets, what you experience interpersonally, what happens is traumatic. Family members also witness that. Family members witness the stories of trauma. They are themselves traumatized by the behaviors of addiction. Whether it is just the lying, the cheating, the stealing, the lying, did I mention that? The lying is fairly pervasive. And that's the best part. At the worst part, it's abusive. Domestic violence, child abuse, neglect. Family members raising babies. It's traumatic. And I think that we need to be able to have a better dialogue, a more frequent dialogue, about how much trauma is experienced when you're loving someone with a substance use disorder. I have experienced this and have been working and starting research about how that is caretaker stress reaction. And that some of the things that we're calling codependency and codependent are reactions to trauma and stress. And we have a great catch term by saying, well, you're very codependent. But that's also minimizing the fact that they experienced trauma, that they experienced significant pain. So it's similar to some aspects of post-traumatic stress, some aspects. So if you're talking about difficulty making decisions in relationships, anybody that's experienced the level of trauma, it's very stunting. It makes it challenging for us to know where to make the next move. What's the right thing to do? Super common question of family members. What's the right thing to do? Like, do we do an intervention? What do I need to do? How can I fix this? So shifting the conversation away from codependency to trauma shifts the accountability. So being trauma-informed, being trauma-sensitive, very important when we're talking about what caregivers go through. And I'm using the term caregiver versus caretaker mindfully. Because they want to give them, that's their heart that is walking around using heroin. That's their heart that's on speed. That's a piece of them. So aspects of caretaker stress: reoccurrent, involuntary, and intrusive distressing thoughts. Hypervigilance. Anytime you hear a siren, like, did they get her? Was there a car accident? Is that the DWI? Problems with concentration, sleep disturbances, financial crisis. Families spend a significant amount of their resources in an attempt to fix. We on the other end of that, we sort of say, well, there's this rescuing behavior. And that's true, it's there. But it's when their finances are completely depleted and they're pissed off about that, there's a reason. There's a reason for that space that needs to be validated. Invasive practices to the degrees that the caregiver is socially isolated. There are many caregivers that stop going out to lunch with their friends because they don't want to answer the question, well, how is so-and-so doing? Acknowledge that loving someone through an addiction is crazy making. That door will open. That's a heartfelt talk. And not, kind of wait for this conversation about how you can best support your addict. Now, you kind of have to dig a bit because family members, their first and foremost thing is going to be, well, how are you going to fix my person? How are you going to fix them? How is this going to be different? What's going to happen? What does that look like? And you might need to let them process that for a minute and then return the conversation back to them. Let them focus on themselves and their experience to addiction. Oftentimes it's a story that's not asked of them. So really, what's that like? How are you doing? If we really want to reduce the stigma and the shame about addiction, we have to be comfortable talking about addiction. Safety planning is still very important. How do you help family members safety plan? Some of that may need to be an education about what addiction is and what are the behaviors that happen in the course of substance use disorder. I think that family coaches, isn't that what you were mentioning before, is family coaching? Beautiful. Attachment is normal, not dysfunctional. And it's important for family members. There's a very funky line between I need to let go and I still love you. In recovery, it is immensely important for the person struggling with substance use disorder to have connection. So on the one hand, we have this advice to family members, cut them off. Don't. There has to be a way to have a dialogue of what that looks like if it's healthy and attached. And education is the intervention for the family. That is, because the messages that are being told in one example is the admissions, but it's also being told by their neighbor and the person up the street that saw this article in Oprah. I mean, they're all getting this information about cut them off, but it depends on the family. The thing is to be mindful to go back, even if they've been engaged in enabling behavior, to go back and reaffirm the trauma, reaffirm the stress, the pain, the fear, and then work your way back up. Does that make sense? Because if we're talking about the client is the addict, we don't give advice, right? We try to be really careful. We're not going to give advice. With family members, it seems that it's a free-for-all. Mindfulness strategies, being present in the here and now, is super important. Meditation, guided meditations. Silencing the thoughts. The thoughts are so fast and so rapid when you're in fear. When you're in fear, your body kicks into overdrive, right? What do we call that? Fight, flight, or freeze. There's this hyperstimulation also that goes with trauma. So they are fighting, and they're mostly fighting. A little bit of flight. But there's a whole lot of, I just did something. It really starts in the body, right? There's this feeling where they're like, my stomach feels sick all the time. I've had family members that know, or think they know, but they're kind of right most of the time, that they know when their loved one relapsed because they feel it in their bodies. So teaching elements of mindfulness strategies is really important. They are the same mindfulness strategies you're teaching folks in addiction. They're not different. Spiritual response. So people's faith in the beginning of addiction and in the middle and at the end has quite a journey. There's always, generally speaking, a space where you get super angry at whatever your spiritual belief is. You get a little hopeful because in many of our 12-step programs, there is this, we talk a lot about the higher power and God, and it's tremendously powerful for folks that are healing from their addictions. It is a powerful part of recovery from addiction. So addiction isn't linear, and recovery isn't linear, and it's very circular. And people have to kind of go through this process a few times, even on the best of circumstances, in different forms. So for families, they can get a little mad at God and higher powers, and they can be disconnected from that, or they roll their eyes when they hear the 12 steps, or they get kind of antsy. Bringing families back to their own spiritual response is important. So as we wrap up, it's important that we reduce the stigma for family members. We are not going to reach the people that we need to reach in this epidemic if we don't really meaningfully reduce the stigma.